Recording.
So welcome everybody. Thank you so much for joining us for navigating a gynecologic cancer diagnosis. We are thrilled that you made the decision to join this evening, either live or to watch this recorded video, because it's going to contain some really important information. And the best part about it is to make you realize, if you're newer to this community, that you are not alone, that there are tons of resources, tons of support available, and we want to make sure that you take advantage of all of it. So my name is Rachel Justice, and along with my partner, Jillian Levinson, we run the Woman to Woman program at Mount Sinai. And the program tonight is a seven-way collaboration with a bunch of organizations that I'm going to name. So Discovery to Cure, which is at Yale, New Haven, WOCA, the Wisconsin Ovarian Cancer Alliance, TEAL, Tell Every Amazing Lady About Ovarian Cancer, Sharsheret, Judy's Mission to End Ovarian Cancer, and MIACA, which is the Michigan Ovarian Cancer Alliance. So again, you are, just by being here in the presence of incredible organizations that we hope you will take advantage of after all of the information that you're being presented with this evening. In terms of the format, we're going to be having three speakers. We're going to hear the medical perspective first, and I'll introduce each of the speakers before they come on. So we'll have the medical perspective first, and you are certainly in for a treat, to say the least. Amazing, wonderful speaker, wonderful doctor in store for you. We will then hear the psychosocial perspective, representative from Sharsheret. And then last but not least, we're going to hear the survivor patient perspective, which is always a really wonderful highlight. We're going to ask that you hold your questions to the end, but we really encourage questions. So please feel free to put them in the chat, and we promise we will do our best to get to all of them. And if for some reason we don't, you are welcome to email after the fact, and we'll do our best to get those questions answered for you. So I think that is kind of the main part of my beginning notes that I always like to to share. And so without further ado, we will introduce Dr. Dickson. So with survivorship as her main goal, Elizabeth Dickson, MD, believes in a team approach to cancer care, incorporating research, integrative medicine, and state-of-the-art techniques to treat not only the patient's disease, but also support her whole being through cancer treatment and beyond. Dr. Dickson is trained in minimally invasive approaches, including traditional laparoscopy and robotic surgery. She has advanced research training and is committed to continuing research in order to better care for women with cancer. Dr. Dickson earned her medical degree at Loyola Strict School of Medicine in Maywood, Illinois. She completed both her residency in obstetrics and gynecology and a fellowship in gynecologic oncology at the University of Minnesota in Minneapolis, Minnesota. And again, we have heard Dr. Dickson before. She is fantastic, and we are thrilled that you're taking the time to join us again today. So thank you so much.
Well, thank you so much for having me. I really appreciate it. I am going to probably talk a little bit on the faster side, but just because I want to get through this part so we have plenty of time at the end to have questions, because I think that's really the big discussion today, is to make sure that we all have time to talk and answer any of your questions you have. So essentially, the kind of overarching theme of my talk is you are not alone. And this is not something that, when you hear the C word, now what is kind of the title of my talk, but really this is something that in a diagnosis, you are not going to be alone during this. You will have resources. There will be people to help you. And on top of that, the other big overarching theme is to speak up and to talk and to ask your questions and make sure that you are heard. So, Ashley, I don't know if you want to just say next. So sorry, guys, that my computer, for whatever reason, wouldn't let me pull up the Zoom meeting, so I'm on my phone. So I apologize if this is a little strange. But again, you are not alone. You are not, as bad as it sounds, you are not the first person to hear the C word, and you will not be the last. Cancer, unfortunately, and we can go to the next slide, what it is essentially your own cells have decided to not listen to what your body is trying to tell them. So essentially what it does is that those cells not only start to grow when they're not supposed to grow, but they start to change in how they look. So maybe a skin cell starts to look different than a normal skin cell. And then they start to try and go other places. So they don't want to stay where they're supposed to be, and they move other places. And that's called metastasis. And so what ends up happening is that those cells are normal responses in our body. They don't listen to them anymore. They've decided to go rogue, and they've tried to say, okay, I know your body is telling me to stay put, but I don't care anymore. I'm going to keep going and go where I want to go. And so how, if we can go to the next slide, how exactly do we start trying to figure out how to treat patients with cancer? And we can go to the next slide, is we talk about all these words, and you may have heard many of these words when doctors and nurse practitioners and your providers are talking to you about the C word. You have all these other words that we try and use to exactly describe what's going on. And the problem is a lot of our words don't make sense. And so some of the words that you may hear, one is called stage, that essentially is where the cells are in the body. And a lot of people, when they hear their stage, maybe it'd be a stage 1, which is usually a local stage, 2, 3, 4, and above, what they're worried about is, what does that mean for me? If I hear that I am a stage 1 versus a stage 4, what is that difference? And where it is in the body is basically all the stages. It actually, while it does give us some information about prognosis, it's not the whole story. Because even though we have some patients who are diagnosed at stage 4, they sometimes respond better to the different treatments that we have than even a stage 1 or 2. So really, stage, bottom line, is just where the cells are in the body. Grade is how the cells look compared to normal. So have they changed? Grades go from 1 to 3, with 1 being the closest to normal uterus or normal cell, and 3 being the most changed. And so how those cells are changing tells us our grade. Grade 1 is usually what's also called well differentiated. Essentially, it looks the closest. Grade 3 can be more aggressive. That doesn't mean it is, it just means it can be. And how do we get information when we are hearing these words? We need to talk to someone that we can trust, and we need to talk to someone who's going to explain things to us in a way that makes sense to us. Next slide. So also, when you have this diagnosis and when you first get the cancer diagnosis, you have to understand and ask questions about what did or what will happen. So the cancer that you have is going to be treated differently depending on where it started, and what we know based on multiple different studies in the past will help treat this cancer. So for example, ovarian cancers, chemotherapy and surgery are our mainstays with ovarian cancer, and we don't typically use radiation. Uterine, we use radiation a lot more, so it could be surgery, chemo, and radiation. Cervical, sometimes it's not surgery at all. Sometimes it's just chemo and radiation. Vulvar cancer, same thing. Sometimes it's just chemo and radiation. And what about more rare tumors, things that we don't see all the time? So the first step is understanding what the treatment is, or if you've already had treatment and you're joining us after treatment, what did happen? Next slide. And then for those who are possibly younger with a cancer diagnosis and they're hearing this for the first time, are there options that will be sparing for fertility? Could you potentially still be able to either have a genetically similar baby, or is it something that your options are not going to be fertility sparing? Surgeries, some of the surgeries that we do spare fertility, some do not. Some chemotherapies do not harm fertility, some do. Radiation, same thing, and hormonal therapy. So again, talking about the options and kind of figuring out what could happen or what your options are, or if they've already happened, what has happened and what does this mean for you moving forward, is a big thing with your initial cancer diagnosis. Next slide. Okay, so I've said this before, everyone is shaking your head and laughing, but the biggest thing that I have to caution about is Google and Google searches, or just searching in general, which almost every single patient comes in saying, well, I looked this up. The problem with Google is that it is very generalized. And a lot of the information that you get, one, might not be from one of those trusted sources, or two, if it is, it may not apply to you at all. One of the things that we are doing much more with cancer care is actually trying to make things as personable and personalized as possible. So precision or personalized medicine is something that we're trying to do for all patients, because as we go back to the very first slide, what is cancer? Cancer is your cells going crazy. And so how do we make the treatment fit you, not anybody else, but your cells? And so Google is generalized, and a lot of the times what you find on there might not be applicable to your case. Okay, so this is a bunch of different quotes from patients who have actually been there. And so the number one, don't dwell on statistics. That goes straight to what I was just talking about, that this is your cancer, not anyone else's. And while statistics are great, they might not apply to you. Knowledge is power. So learning what different options you have, talking with your providers, seeing what can be done for you to make this personable for you. Be your own advocate. That's a big one. Making sure that you are talking about what's happening, because we as providers may assume certain things, but don't actually know how you are feeling unless you tell us. We're not sure that you're having neuropathy from your chemotherapy, that you're having terrible pain from your surgery, that you're having bleeding, this, that, and the other thing, unless you tell us. So you need to tell us and be very an advocate for yourself. Don't rush into treatment. That's one where we talk about this a little bit too. You need to feel as though you are comfortable with the treatment that you're being given. If you are given a certain treatment protocol and it does not seem right for you, or you don't feel comfortable, talk to someone else. Have a second opinion. There is no practitioner on this earth who will tell you that a second opinion is not something that they would say, yes, go and do that. Because if you talk to someone else and either A, feel better about that treatment plan, or B, like a different treatment plan other than what was already discussed, then you could have that as an option, and maybe it's the right option for you. So a second opinion is always okay. Couple more of these because I don't want to dwell on this. You don't have to face cancer alone. We'll keep talking about that. This is a big one. Maintain as much of your quote normal, not that anyone's life is normal, but normal things that you do on a daily basis while you're on treatment, because that helps you feel like you have control over something that you may not have control over very much when you're in treatment, but you have control over those normal things or those everyday things that you do and the routine that you do as much as possible. That really helps you get grounded during treatment. Next slide. But why is this happening? So that's a big question. Again, with this advocacy for yourself, if you are talking with your provider about your options of what to do, is it surgery? Is it chemo? Is it radiation? Is it none of the above? Ask the why on what we are recommending, because we assume that people know the reason we're recommending things, but that may be not the case. And it may be we're saying, okay, this is what we're doing, but we don't actually tell you the why about it. And knowing the why about it actually helps understand some of the different side effects and makes it more tolerable even to look at that, what's going to happen if you understand why this is happening. Next slide. So how can we make some of the things that we do, because all of these things, surgery, chemo, radiation, hormonal treatment, all of them have some side effects. How can we make those side effects better? And I think that this is a big point, is the biggest problem in communication is the illusion that communication has taken place. Essentially, we think that we have told you what's going on. You think you have told us how you're feeling. And maybe that's not the case. So keep speaking up, keep talking, keep asking those questions. Next slide, which goes to being heard and making sure that if you have a question or you have a concern, you talk about it. And if you feel like your provider is not listening to you, there are other providers who you can talk to. And so keep talking, keep being heard until you feel like your voice is being listened to. We are a team, which we'll kind of talk about that as far as the different members of the team, not only the providers, but also there are social workers and physical therapists and acupuncturists and aromatherapists and many, many people who can be part of your team to help support you on this journey. And this kind of goes with some of the stuff we've said as well, that this is because cancer is your diagnosis and what is happening with you and your cells. You have to find your own path of how getting treated is going to work for you. Next slide. This is something too that we've talked about in the past, but a big push now is more movement is better than less movement. And so some of the things that we do moving forward as far as treatment, some of the side effects can actually be alleviated or lessened by continuing to do physical therapy, continuing to be active. Actually, we know now that patients who aren't as active or who are more sedentary or in bed during their chemotherapy or things like that actually do worse than those who get up and move and use physical therapy and movement and things of that nature to help them with their side effects from chemotherapy. So a little bit of hope. This is a big one because especially when you hear the cancer diagnosis, a lot of patients immediately can't see that there could be hope, even with a cancer diagnosis, but there can be. And talking about how you're feeling and talking and getting your support system together really helps build that hope. So I think we're going to save the questions for the end, but hopefully we can answer all of your questions and give you the answers that you need. Thank you very much again for letting me talk.
Thank you so much. It is such a wonderful talk with so many important takeaways. I love that you say you are not alone. Actually, the motto of Woman to Woman is you are not alone. But the fact that a doctor is saying that, I think, is just even more powerful. You know, it's almost like a prescription. And I love the community aspect of your talk also. And I think, you know, one of the really, really important takeaways is that if you're not getting the care and the communication that you feel would be helpful to you, then try to figure out how to get it, you know, and whether that's communicating about the lack of communication or finding someone else who communicates in a different way. I think that's so important. And so I just hope that attendees here today who are newer to this situation feel empowered after hearing Dr. Dickson say it, because I think a lot of times there is this level of, you know, if I say, you know, if I question the doctor, or if I, you know, say I want a second opinion, or if I don't understand something and I take too much time, that there's going to be kind of pushback. And, you know, I just think, you know, that hearing it from you directly, you know, that please ask the questions, you know, please, you know, get more information, please communicate. It's really important and wonderful. So thank you, Dr. Dickson.
Well, thank you. Thank you very much.
Of course. So our next wonderful speaker is Aimee Sachs. So Aimee is an MSW, and she is the California Support Program Manager at Sharsheret, and she's a graduate of Washington University in St. Louis and the UCLA Luskin School of Public Affairs. Aimee assists in the delivery of Sharsheret's cancer support programs and coordinates tailored support and resources for people living with and at high risk of developing breast or ovarian cancer. So Aimee, thank you so much for being here. Really looking forward to the important information that's in your talk.
Absolutely. Thank you so much for having me and having Sharsheret. I'm ready to join the Dr. Dickson fan club. So I don't know where signups are. But just like you said, Rachel, she nailed so many points that we usually don't hear from healthcare providers. And I think it's really important that everybody really hear those. So thank you. And a lot of that is going to be echoed, you know, in what I have to say. So just a quick introduction. Sharsheret is here for everybody facing cancer. Our area of expertise are ovarian cancer and breast cancer and the genetic predispositions towards them. However, we are absolutely here for anyone with any gynecological cancer, any other cancers. I get calls from people with, you know, all different types of cancer. While our area of expertise might not match up with what they're looking for, we will always provide support and resource referral to the right resources for them. And our area of expertise is also in the Jewish community. However, a large percentage of our callers do not identify as Jewish, and we don't really bring up the Jewish piece, but sometimes it can be really helpful. As you know, when we were waiting to get started, we were all talking about how we spent our holidays, and it can be impacted, certainly. So a little bit about, what do social workers do? Because like Dr. Dickson mentioned, you come into contact with social workers. They're part of your treatment team, and they're part of the cancer space, right? So hospital social workers, assist with everything having to do with the hospital experience, insurance, financial resources. They also know a lot of local resources that they can help with. Your doctor's practice, might be within a hospital, but they might also have their own social worker. And so they can help with a lot of those similar things. And sometimes even communicating with the doctor if you're having any trouble with that. Sharsheret social workers, which I'm one of them, often we find ourselves filling in the blanks that these other social workers might have. So, we'll send you our Sharsheret resource kits. Everything we do is completely free, confidential, and personalized. So, we send care packages. We, like I said, connect you to other organizations. We provide a lot of therapeutic support. We don't provide therapy, but as I always say, I have a lot of therapeutic conversations. So sometimes I'm the call between therapy appointments for people. Whatever somebody's looking for, if it's something Sharsheret provides, we'll provide it. If it's something that another organization provides, we'll make that connection. There are also other social workers, maybe in private practice, maybe your therapist is a social worker, or maybe you'll come into contact with them at other cancer support organizations or other types of organizations. So, what do you talk about with your social worker, or what are you going to ask them? Certainly they're there to help you figure out who else you might want to ask your questions to. So sometimes your doctor might say something and you're like, I don't understand, and I forgot to ask the doctor before I walked out, but now I'm thinking about this question. You can go to the social worker, and sometimes they'll direct you right back to the doctor. I do a lot of that, but I also can share, well, I've heard about this discussed, before, and it could be this or this, but I'd still go back to your doctor. We do a lot of talking through decision-making, right? So often people will call me and say, I'm thinking about doing this or doing this.